Okay. Dr. Martinez, a person has dentures, and after a few years, that denture kind of seems to be having a tendency of getting a little loose, wiggle-woggly, and being like a little big boat. Now, many patients think that something is wrong with the denture, when it is really their jawbone shrinking away, and it's just like, I think something is wrong with my pants because they don't fit anymore, when it is really my tummy which is kind of growing. My wife tells me so that I'm, very mistaken, and because I say, look, what are we doing to my pants? They shrink, and she says, no, honey, you grow, and you shouldn't. You're out of the growing age. You really shouldn't grow. She makes sure she adds that. Anyway, what are the choices here? And I've heard that there are definitely these days the choices where you can fix or make a new denture, but make it in a way where even though you have a denture, it will then fit for more or less, almost, maybe even for sure, all your life, because you kind of like couple it with a few implants, very few. So it's still extremely economically affordable to just about everybody, and yet day and night in terms of ability to eat compared to a normal regular denture. Tell us about it.
I'm not sure if I understand correctly, but I think you're talking about an implant retained denture. And what I think you're referring to is the fact that it's like anything. When we have our teeth in our mouth, the root actually of our teeth stimulates the growth of the bone, or for us to keep the bone that we have. And the reason that once we have dentures, full dentures and all our teeth taken out, we don't have that stimulation of the root on the bone. So it starts shrinking. The denture really doesn't shrink. Of course, we know that. You just mentioned that. It is actually, the bone itself is shrinking. So a lot of people complain that their dentures don't fit anymore. And that, like you mentioned, it's kind of like a little boat. Or I always refer to it as, like kind of big shoes that have been worn for so long that they're just so wide that they don't fit anymore. But again, one other thing in the technology, I've been a dentist for 20 years. And in the past, 20 years ago, yes, implants started coming out, and it was a new technology, but it really wasn't accepted as much as it is now. And in the past, when we saw a patient that had just no bone left and that had to wear a denture because that's the only thing that they had, really kind of had to put up with the fact that that denture would never fit, would create sores in their mouth because that denture would flop around in their mouth, kind of like skating on a skating rink, flat on flat, because you really don't have that retention from the ridge.
And it hurts to be on your butt all the time. It hurts to be on your butt all the time. I'm telling you, I know about it. I've tried it.
So then what happens is, so they were stuck pretty much not having good quality of life, if you will, because they can't eat, they can't chew with this loose-fitting object in their mouth. But now that we have implants and the technology has improved so much, we have the ability to place a couple implants, 2, 3, maybe even 4 implants. Especially, right now I'm describing the lower ridge, the bottom teeth, where we can strategically place 2 to 4 implants. And on these implants, you can get a denture to clip on. So if you can, just the word itself, to clip on, and you're giving a patient the ability to chew, an ability to wear a denture that actually fits because it doesn't move every time you talk. It doesn't move every time you chew. It's not rubbing against your gums and creating these sores. It has really, really improved the quality of life, in my opinion, of people. The patients that I have seen and we've done that for, it is night and day from when the moment they walk in the door and say, I can't deal with this anymore. I've lost all this weight. Or actually, there's people that have gained weight because they're chewing they can't chew their food. They're swallowing it whole. So they've created digestive problems because they cannot chew their food. So we are talking about people that have been suffering for very many years to now being able to have the technology to help them out, which I think it is awesome. I think it's great that we can do that for people.
So when people have this, kind of, I call it a hybrid. Don't know if that's a good name for it. You have not all the implants and you have not all denture. You do have an all denture, but you have it, anchored in with implants, and thus it's not like having 12 or 15 or whatever it is implants around your mouth, but it's literally the very, very next best thing. As you said, a world of difference from just dentures, and of course also a world of difference still in lower price. If they have that hybrid denture, can they eat an apple? Can they bite into a steak? Because you see, it's the lifestyle which we're all after. That's really what it is. You know what I'm saying? We don't care about being weak or not weak. We do, however, care not being able to lift our grandson up. You see what I'm saying? It's that type of stuff. So can they do that? Can you see a difference there?
Yes, you can. You can see the difference in wearing a denture that has the clip-on. It's clipping onto an abutment to an implant versus a denture that is not. And that especially a denture that does not have any bone to be able to hold on to.
Beautiful.
To get that leverage when you're biting onto something like that. So yes, it can be done. And I've seen it done. I've seen where people, like I mentioned earlier, go from not being able to eat or chew their food to being able to really enjoy what they're eating, and getting it done. So.
Great, absolutely great. Good news. It is really nice to see that dentistry has not been bypassed with modern technology. No. On the contrary, as you mentioned earlier too, that we have so many choices sometimes that it makes it difficult to adapt. I think from a patient's perspective, it's awesome that they have so many choices, that, dentistry is not what it used to be. I hear the horror stories, but dentistry is very spa-like now. Mm-hmm. Yeah. Well, and in terms of choices, that's why we have you. You as a you, and you as a profession, as a dentist all together. Thank you very much.
Yes.